I joined the group because I feel like this is a very small piece of the puzzle in a massive global health problem and issue and possibility. I'm interested in helping to create a better global health future.
And the fundamental aim of this group is to enhance the voice of the young scientists, especially to solve the global health problems.
It is my passion to try and help advance the Sustainable Development Goal, especially number 3 on health and well-being. And here at the Global Young Academy we have many other members that are also working on this specific Sustainable Development Goal.
There are a number of challenges. We have our own mechanisms of working. We have the senior academies, but there is an opportunity there always for young voices to be inserted into our working groups.
I joined the Global Health Working Group because I think health is one of the common things that connects us in the world. Whether you live in the south or the north, it's one common thing that defines us as humanity.
The idea to create the Global Health Group within the GYA was pretty much different than my everyday practice. What is very important in our work is that we are going to explore associations between health of the society and political views and political choices.
Our aim is that we want to be a leader of the global health. So our voice will be heard in the by global society, global policy makers.
So I think it's up to them to decide what they want to do, whatever they come up with. I think it'll be a great idea and we will try to assist them on the way.
What I would like to see more of is an exchange of good practice example, that people have an understanding that we are facing problems in global health to which we often have solutions. We just need to enable people or become able to implement them.
We are facing the many global health problems now in this 21st century, like the infectious disease, communicable disease, and so many other problems like antimicrobial resistance and others. And in order to address those problems, we feel that we need a multidisciplinary or interdisciplinary team.
We see that in the diversity of the group.
So we have people from all kinds of nationalities and all kinds of fields. So in our Global Health Working Group, there's people with a physics background, people with anthropology, sociology, medical doctors. So all these different fields getting together will also bring a different perspective to the table, I think.
And I hope that we would be able to draw on that diversity to address some of these emerging challenges.
At the moment, I'm doing a research project which compares how medical students learn the clinical skills of diagnosis in 3 different areas of the world, in West Africa, Western Europe and Eastern Europe. So essentially, my research brings a perspective on global medical education that takes a comparative approach across time and place.
Inequality is an important thing that we need to begin to think about globally. How can some people live up to say 95 years and others just live on the average 45, 60 years?
The ability to analyze medical problems not on the individual level of a single person, but to look at health at the population level.
And I realized that global health issue can be solved only through the environmental interventions, through the improvement of environment. So I try to dedicate my life in the climate and health issue.
I mean, the economy itself very much depends on health of the society, but it's also opposite way, the other way, so the health of the society conditions the economic growth.
I joined the group because it's my area of passion. I'm really interested in everything related to health, and I think global health is the area where I can work on that.
To see if we can together find a way to help advance this field through the voice of young scientists.
I feel like this is a tremendous opportunity to do this with other young scientists from different countries and different disciplines, all with the same aim.